All right. So, Dr. Gregory Stowe here from Spine Health and Wellness, and we're doing another patient interview, patient testimonial. And right here we got Mr. George, who was so kind to take his time out of his day on a Sunday afternoon to do this interview with me. And I just wanted to, turn it over to you, George, and just give a little idea, a little, some information on your experience at our clinic and maybe what you were dealing with and how we were able to help improve your life.
Hi, Dr. Stowe. Thanks a lot for having me, and thanks a lot for helping me. I really appreciate it. I guess to give you just a little bit of background, I've always had a lot of chronic pain. I've had a lot of sleep issues over the years, and I was recommended by a family member to go see Dr. Stowe. And frankly, I mean, I think that his services were excellent. One of the things that I really appreciated about being able to go to his clinic was the fact that he took x-rays and he gave comparable x-rays that showed my spine alignment and my body alignment. It showed measurable differences from what we would expect to see and what I was experiencing, and found out really that I had some significant misalignment issues. Some of them actually were work related in the sense that I had bad posture and some of the things that I was doing. Some of them were sleep related. I didn't realize my sleep habits actually were affecting the way that my spine was aligning. I never would have imagined this or possibly drawn that conclusion if it hadn't been for being able to see the x-rays and p-rays that Dr. Stowe and his staff had given me. Subsequently, we were able to go ahead and do a treatment program that helped me to not only get into the process of realigning my spine, but really learn how to take care of it long term, to be able to do exercises at home, to be able to use thoracic blocks, for example, and put myself in a position that could really remedy the situation to the extent that I could. And I appreciate that very much.
And you were recommended surgery, is that correct?
I was, yes.
And do you feel at this point I'm sorry, go ahead.
Yes, I was actually recommended to get a hip replacement, which is a pretty significant surgery for someone of my age. So that was really a pleasant surprise to the situation, because I really went to Dr. Stowe because of back and neck issues. But in reality, the back issues also helped my hip issues, to where at this point in time, I think I told Dr. Stowe that I'm walking 30 to 40% better than I had previously, and the pain is reduced probably 80% over what it was. So I mean, it's a huge difference in my work life, and that leads to better results in everything that you do, reducing that much pain.
And the treatment, a lot of the aggressive treatment we did with you, that was several months ago now. You still continue to the things that we taught you, you continue to do to help maintain that improvement?
Yes, I do.
And just between you and me, like, it's just every time, I feel like I want to give people enough tools to continue to maintain as much as I can help prevent people from having to come back for chronic pain. I think the more we give to support people, the better off they'll be. So anybody who comes into the clinic, we really try to give them the tools and educate them on understanding their condition so they don't have to have a repeat. And our goal is hopefully that surgery gets pushed off until forever for you. But even if we get 20 years, I mean, I think that's great.
Yeah, absolutely. Especially given my age, the longer I can wait, really, the better. But regarding the tools that you've given, yeah, when I follow them, I just feel so much better. If
That's
I let a
awesome.
week go by, I start getting lazy or what have you, wow, I really feel it. And I realize I got to go back onto that regime, go back onto that routine. And once I do, again, that corrective factor goes in there, and it reduces my pain, reduces things that restrict you in everyday life, meaning the pain and of course the movement, the mobility issues too that I was encountering. So.
Yeah, we can help a lot of people out with like that, the chronic posturing at work that we have to get into, sitting in the chairs or getting into small spaces, depending on the type of work you do. Those things continue to age us and continue to make our bodies break down. So being able to just grab those tools again and improve your situation, saves a lot of money in the future, saves time, and quality of life. You maintain a better quality of life, so it's great.
Yeah, definitely. And I've recommended you to a lot of my workmates. I don't know how many have shown up and who haven't, but just seeing again that posture issue that we see many people have on the job site, whether it be in an office or out in the field, whatever the case may be. It's kind of interesting to see it put into place. If we can get away from that hunching over, leaning over, moving into awkward positions, it really has a huge effect on us. Like you used an interesting word, the aging. I didn't really think about it as far as aging is concerned, but I probably seem like I'm 10 years younger than what I was before all this started. It is an aging thing because when you feel better and you have energy, you literally come across as being a younger person. You feel like a younger person, and so that really is an interesting term, and it's correct. Yeah, I feel younger.
That's incredible. I'm really happy to hear that, and I thank you for giving up your time today to help me let other people know about how you were helped at our clinic. I think that's great, and I really appreciate you. So I want to say thank you, and also thank you for the referrals. We appreciate referrals. We love helping out people in the community.
Absolutely. I appreciate you and I appreciate all of your staff.
All right, thanks again.